So welcome everybody. Thank you for joining us today for the Rural Health Workforce Resources webinar. And today we're focusing on the Delta Doctors and AmeriCorps NCCC program. My name is Shannon Studden and I am the Workforce and Leadership Development Team Lead here with the Delta team. We're really excited to have 3 speakers joining us today to share information about 2 workforce related programs. And it feels like we've been talking about this for a long time, so I'm really excited it's finally here. Christina Wade is here to give you an overview of the Delta Doctors program for about the first half hour of our time together. And Tamika Eatman and Mackenzie Hunter are here to talk about the AmeriCorps National Civilian Community Corps, or AmeriCorps NCCC program, for the second half of the time that we're together. The 2 programs are pretty different, but each of them provides some really valuable support and resources that may help you fill different workforce needs in your organization. So first half of the webinar will be dedicated to the Delta Doctors program and the second half to AmeriCorps NCCC. So I'll tell you more about our speakers in just a minute, but first I'd like to go over a couple of housekeeping items. First, the webinar today is being recorded and will be posted to the center's website, and you'll all be notified once the recording is available. Second, there'll be time available during each program's presentation to ask questions. And you should feel free to submit your questions anytime in the chat. We'll hang on to these and we can share them with our presenters during Q&A time. We also encourage you, if you're interested, to unmute and ask your question directly of the presenters when we're at the question and answer time. So let's get started. Christina Wade is here to share about the Delta Doctors program. I'll take just a minute to introduce her and then turn things over to her. And when we switch to the AmeriCorps portion of the webinar, I'll tell you more about our presenters, Tamika and Mackenzie. So Christina Wade joined the Delta Regional Authority in March 2016. She oversees DRA health programs, including Delta Doctors, Innovative Readiness Training, and Delta Region Community Health Systems Development Program. I should be able to say that without stuttering after so much time. She holds a Bachelor of Science degree in Business Administration from the University of Missouri at Columbia and a Master's degree in Public Administration from the University of Louisiana at Monroe. Christina is also a graduate of the Delta Leadership Institute and the Harvard Kennedy School Executive Education Program. She has over 13 years of experience in community development, economic development, and affordable housing development. Originally from Caruthersville, Missouri, Christina is an active yoga instructor, running enthusiast, and enjoys spending time with her daughter, Jasmine, son, Kenny, and dog, Kane. So thank you so much for being here, Christina, and I will turn things over to you.
Thank you, Shannon. Sorry for such a long bio. I need to really shorten that. My name is Christina Wade. Again, I am the Health Programs Manager for DRA. I'd like to talk to you today a little bit about the Delta Doctors program, but first wants to kind of give you an introduction to the agency. Next slide, please. Next slide, please. So DRA was established by Congress in 2000, and we make strategic investments in public and human infrastructure here in the Delta. So that's basic public infrastructure, transportation, workforce training, and small business development. Next, please. So here's our footprint. We cover 252 counties and parishes across 8 states. Next, please. We are led by the federal co-chairperson and alternate federal co-chairperson and the governors of the 8 states within our footprint. Next slide, please. So there's our board of directors. Next slide, please. So kind of just wanted to give you some stats about our region really quickly. Over the 252 counties and parishes that we serve, we have a total population of a little bit over 10 million. Next slide, please. Of course, the average earnings per job is below the national average. Next slide, please. Median household income, as you see there, again, is below national average. Next. Education in the Delta, a little bit more than 50% of our population either has a high school diploma in some college. So there's the breakout there. Next. So we are committed to promoting a healthy Delta at Delta Regional Authority. Although we're thought of as an economic development agency, we know that a healthy workforce drives economic growth. So this is why we invest in health programs at DRA. Next. Next. Thank you. So just a few health stats again. You can see here, 31% of the children in our region are below the poverty line here. Next. 8.1% are experiencing unemployment again, which is above the national rate. Next, please. 55% of our population they're participating in the workforce, which again, compared to the national average of 61.5. Next. 18.2% of those living in our footprint experience food insecurity. Next. So here are the chronic disease and lifestyle factors. As you can see, 36.6% of the population is obese, 21.4% smokers, and the average life expectancy is 74.6 years. Next. 1.9 average number of days per month that residents living in our region experience fair or poor mental health. So if you think about that, that's more than once a week. That's a lot. So it's really important for us to also focus on this piece at DRA. Next, please. So now let's start to talk about the Delta Doctors Program. 241 of the 252 counties and parishes that we serve are in a health professional shortage area. That means that there's a shortage of primary care providers in our region, and 244 of the 252 of the counties and parishes that we serve are medically underserved. Next. So that's the primary care, the patient to physician ratio is 1,504 to one patient. Of course, that's above the World Health Organization's desirable doctor-patient ratio. Next. So Delta doctors, so to increase the access to quality healthcare here in the Delta, we established the Delta Doctor Program, which allows non-domestic physicians who are trained in the country to come to the Delta to work, where it is very difficult to get American physicians to come here. Next. So what we do is we work with the Department of State. We make recommendations to the Department of State that they basically say, this physician is going to commit to staying in the Delta for X amount of years. They're qualified to work here. They're working in a health professional shortage area. Please allow them to, come to the Delta, stay in the country, and serve a much needed population. Next. So here's our breakout. Last year, I reviewed 173 applications for the Delta Doctors Program. That means 173 physicians were able to come to the Delta and provide much needed services. And these are not just primary care physicians, they're also specialists. So you have neurologists, cardiologists, and that's the split. Of course, Alabama and Louisiana, they have the highest placement rate. And then there, you see the breakout there. Okay, next. So who's eligible to apply for this program? So of course, primary care physicians and specialists, they have to be trained in the United States and they have to agree to certain terms. So they're going to provide direct patient care for 3 years. They're going to provide direct patient care for 40 hours a week or 160 hours a month. They have to agree to serve patients that receive Medicare, Medicaid, or participate in a charity program. And also of course, you have to comply with our guidelines. Next. So what is an eligible area? Not only do you have to be within the 252 counties and parishes in our footprint, you have to be in a medically underserved area or a health professional shortage area. Again, that's typically not a problem. I think in one of the previous slides, about 241 counties and parishes are in a health professional shortage area, but there are some communities that are not. They have maybe a university hospital there, and that kind of, they may not be in a health professional shortage area. So next, please. So there's the breakout. You have HPSA scores, which I'm sure all of you are familiar with. We don't look at a score. You just have to be in a health professional shortage area or a HPSA. So the darker the green, the higher the score. And if you remember what our footprint looks like, we're pretty dark green there. Next. Or the area could be medically underserved. Again, you're looking at the yellow here. And if you remember what our footprint looks like, most of our area is yellow. So most of the counties and parishes that we served are in a medically underserved area. So how do you get started? I review J-1 visa waiver recommendation requests on a continuous basis year round, but the most important, the key element here, you have to advertise for 45 days for an American physician. Because what we say in our recommendation to the Department of State, we say, you know, this hospital has searched for 45 plus days for an American physician to work. No American physician was interested in coming to, you know, this remote area. So we would like to hire a J-1 visa physician. So that's the most important step. We have to advertise for, or the hospital has to advertise for the position for 45 days before engaging with a J-1 visa waiver physician. Next. So if you're interested in submitting an application, of course, we have a program overview packet on our website. And I thought that it would be a good idea to just run through what that list of documents that I require look like. Next. So here's the checklist. There are about 26 documents that I am required to review. The first document is called a G28. It basically says this attorney is going to represent the hospital. And again, the packet, I don't know if I mentioned this before, I don't think I did, but the packets are submitted by an immigration attorney on behalf of the hospital or the physician. So we do not accept applications directly from the hospital. They must come from an immigration attorney representing a hospital. The second item that we require is a letter from the employer, and it has to have all of those items that you see there. The HPSA number, the MUA number, a little bit of information about the physician, 3-year data that shows that the hospital does serve Medicare, Medicaid, and charity folks that receive some type of other type of assistance. And also has to have the patient to physician ratio. So what we don't want to see is the market saturated. So if you have one doctor for every 50 patients, there's not a need there, if that makes sense. So really the patient to physician ratio might say there's one cardiologist to every 10,000 folks in the city. That's a need or in the county. So that's what we're looking for in the cover letter. Next, please. The third item, the DOS data sheet, I'll just refer to that as a document that's required by the Department of State. And that's why we require immigration attorneys to submit these packets to us. It can get quite complicated. Next item is a CV with a social security number, you know, a resume. The fifth item is another document that's required by the Department of State. And then the most important item to us at DRA is the contract. So in the contract, the physician has to say, of course, they agree to work for 5 years. There can't be a non-compete clause. So the hospital can't say, you know, after your 3-year service term is up, you can't go work across the street, or you can't work in the next county over or in the city. So we have to make sure that there's not a non-compete clause in the contract. And again, what we talked about before, working the proper number of hours per week, and the salary has to be at least prevailing wage. Next, please. We have to have proof that the hospital is located in a HISPA or MUA. We have to make sure, in HRSA, if you go to HRSA's website and you click on, and you just kind of type in HIPSA MUA by address, you can type in your work site and it will pull up a report that shows if it's in a HIPSA or MUA. The next item is another document required by the Department of State, items number 8 and 9. Number 10 is a letter of opinion from your attorney. 11 and 12, those are DRA documents that that the physician and the employer have to sign. Number 13 is the prevailing wage data. We just need to make sure that the physicians are being paid fair wages. So that is why we require those documents. Next. Recruitment documentation. So earlier when I said that it's very important to advertise for 45 days before you engage with a J-1 visa physician, I have to have documentation that actually shows, yes, I ran an ad in JAMA, I put an ad on Indeed, I wrote to medical schools. So we do have to have proof that there was advertisement for at least 45 days. And next is letters of community support. We require those. We require letters of recommendation. We like to see the copies of, the US LME scores, diplomas, medical licenses. Have to have proof that the work site actually exists, believe it or not. Also have to have proof that the hospital offers some sort of financial assistance for those that might not have any type of health coverage. And of course, we want to see the list of other primary care providers or specialty physicians in the county or pairs in the passport. Next. We have to have a statement from the physician that says, why they would like to work in the Delta. And then the last few items, those items are for specialty physicians only. We require a little bit more information for specialty physicians. Next, please. So after I have all of those items, I review them all. If everything looks good, and most of the time I have to go back with the attorney and say, hey, you forgot to put the prevailing wage information in here. Hey, you guys didn't advertise for 45 days. So once we go through that, I have the packet, everything looks good. I write a recommendation letter to the Department of State, and I send that information on over to them. After their review and after USCIS's review, the physician, if everything goes well, is allowed to work in the footprint. And that's when our compliance period begins. Once the physician works, I have to verify that the physician's working, and I have compliance reports that are due twice a year. And this doesn't typically happen, but we also might need to visit a site should we receive a compliance report that's not favorable. Next slide, please. So each state has a Comrade 30 program. It's a J-1 visa waiver program. They have 30 slots, and that's not a whole lot of slots. So that's one of the reasons why folks come to DRA. We have an unlimited amount of slots, so I can review as many applications as I can in 40 hours per week. And also, we don't have a limitation on the number of specialists. So I wouldn't say that our program is more flexible, but it allows for more physicians to be placed in the region. Next slide, please. So you'll get a copy of this slide deck. They're the websites for each state agency, if you're interested in the Comrade 30 program. Next. So here are a couple book recommendations. The Physician Immigration Handbook is just a really good tool to have, as well as the Foreign Physicians Immigration Handbook. That second handbook is just it's a really thin book. just good to have on deck if you're interested in and maybe bringing on a J1 visa physician. Next slide, please. I know I went through that really quickly. That was 40 slides, but I did want to leave the opportunity for questions if anyone has any questions for me.
Christina?
Go ahead, Greg. Go ahead, Greg.
This is Greg Roback. I'm with a federally qualified health center in Missouri. I was investigating J1 physicians last year during the Trump administration, and and COVID had placed some restrictions or limitations on the amount of J1 and subsequent green card individuals, primarily, I guess, due to COVID. Do you know what the current status of any of that is? My assumption is as COVID lessens, which we all hope and know it will, that those short-term restrictions will be lifted. Do you know any change or what the status of that is currently? Thank you.
So thank you, Greg. Were you working with the Conrad 30 program or?
No, there was a physician that we were in contact with through a recruiting firm who would need a J1 placement. And per his experience and per my research regarding the J1 program, it was difficult midsummer of last year, even considering that. Do you know if that has changed?
I am unaware of any situation like that, Greg, and we can always talk offline about it.
Okay.
I reviewed over 160 applications in the prior year. I didn't see any barriers, but again, this could be an individual case or just something that I'm not aware of, and we can definitely talk about it offline, if that's okay.
Thank you.
Anyone else have any questions?
Yeah, feel free to unmute yourself or type your question in the chat. Just give a couple of seconds here for any questions to come through chat, but Christina's contact information is on the next slide. So you can always get a hold of her. Oh, thanks, Caleb. So you can always contact Christina directly. And if you just lose track of this slide deck or Christina's contact information, you can contact any of us on the Delta team to get you connected with Christina.
And Shannon, I'm trying to think of anything I might have left out. Oh, the processing time. So once I receive an application, hopefully it's perfect. Everything's in the packet, I review it. We have given ourselves 60 days to review these applications only because we receive so many. If you think about it, the state has the Conrad 30 program. They received 30 applications. Last year, like I said, I reviewed 173. So it's quite a bit to look through. So it's going to take about 60 days on my end, maybe before, just, maybe not exactly 60 days if we don't have too many to review. After that, the Department of State, of course, they have their time frame, and then USCIS has their time frame. But DRA can turn around an application in 60 days or less if everything's perfect.
Thanks, Christina. I don't see any other questions coming in.
Great, thank you, Shannon.
Thank you so much. This is such a valuable program, and I expect you'll get some follow-up from some of the organizations in the Delta program. So just a reminder, just reach out to any of us on the Delta team anytime and we can get you connected with Christina. And also, as you know, her contact information is here on the slide. So next, we're going to shift our focus to the AmeriCorps NCCC program, as I'll tell you a little bit about our two presenters, Tamika and Mackenzie. So Tamika Eatman is an assistant program director at AmeriCorps NCCC, the Southern Region campus located in Vicksburg, Mississippi. Serving with the agency for 8 years, Tamika develops projects and provides grant application assistance throughout the states of Mississippi, Alabama, Louisiana, and Tennessee. As the Assistant Program Director, she supports NCCC members, staff, and external partners in the planning, development, and coordination of projects, helping to identify needed resources, timelines, and metrics for success. She's a proud AmeriCorps alum who attributes her service year as an AmeriCorps Promise Fellow to a career dedicated to service, youth development, project planning, and training. Mackenzie Hunter is one of 3 assistant program directors for the AmeriCorps NCCC Southwest Region campus in Denver, Colorado. She leads outreach and project development efforts with project sponsors in the states of Missouri, Kansas, and Oklahoma. Mackenzie served as an AmeriCorps NCCC team leader from 2011 to 2012 and was on the Alumni Leadership Council as the Southwest Regional Representative from 2016 to 2018. She has a master's degree in public and nonprofit management from the University of Texas at Dallas and a bachelor's degree in psychology with a minor in sociology from Alma College. So just to note, those of you from Illinois and Arkansas may have noticed that your states weren't covered in the bios that I just read. Arkansas is part of the Southwest Region campus where Mackenzie works, but you would have a different contact in her office. And Mackenzie, tell me if I'm misspeaking here. Illinois is part of a different campus, the North Central region, and Mackenzie and Tamika will share contact information for that campus today. And just like with the Delta Doctors Program, you can also contact me or anyone else on the Delta team anytime, and we'll get you connected with the right person. So Mackenzie and Tamika, thanks for being here, and I will turn things over to you.
Thank you, Shannon. So happy to be here today, and so excited that you have invited us to talk with everyone today. So with AmeriCorps, I don't know if everyone's on the call is familiar with AmeriCorps or not, and I would love to kind of just see, so if people could maybe put thumbs up if you're, in AmeriCorps or not in the reactions, just kind of react with thumbs up or not if you've heard of AmeriCorps program. But we're a wide array of different programs that serve a lot of different needs throughout the country. And so with that, with AmeriCorps, there are basically 3 different branches that fall under AmeriCorps, and then also our AmeriCorps Seniors. And our AmeriCorps Senior program is specifically dedicated to providing service opportunities for individuals who are 55 and older. So we have that, and I'm seeing someone in the chat said they're very familiar with AmeriCorps. Awesome to see that. So then, we also have the state and national program, and some of you may be more familiar with with the state and national, maybe some of the programs that are more educational programs or different things that are run by the state. Maybe you've heard of City Year, Teach for America, those types of programs. Those fall under our state and national programs. And then VISTA, another branch, and I'll show you some of the differences shortly. And then NCCC, which is a part of the program that we represent here. And so NCCC also has, what we're going to do is talk about the program that basically serves with different communities, agencies, and government agencies. But then we also have a branch of NCCC that specifically works with FEMA. And so we send teams to work directly in times of disaster, also doing mitigation, but they only support FEMA. And so we also have that special FEMA Corps program. But we see our programs as uniting America by bringing people together to serve communities. And that's what all of these different types of branches of AmeriCorps do. So next slide, please. So this gives you even a better breakdown of kind of what the focus areas are. And like I mentioned, kind of talked about a little bit earlier, it is a diverse structure for diverse needs throughout the country. And so if you're looking at your state and national, you are thinking about some of your kind of educational programs. They do a lot of direct service. So things where you can think about hands-on, that type of need, then you'll mostly think about your state and national programs. VISTA is more of an indirect program, poverty focused. And if you maybe you've heard about VISTA, maybe that one person that serves with an agency or two, and they're with them for year round. And so they're doing things like volunteer recruitment, things of maybe grant writing and supporting in that way. So that capacity building is what VISTA program focuses on. And then you have the NCCC program, that we're going to continue to talk about. And so that is a team-based program. Our program is specifically designed for 18 to 24, now up to 26 teams of individuals. So a group of individuals somewhere between around 8 to 10, and it could be a little bit less or a little bit more, travel the country within the different regions that we serve. And so when our AmeriCorps members sign up, they sign up for 10 months of service. And so they're going from they're going from community to community within maybe 6 to 8 weeks at a time throughout their 10 months of service. And so when you're thinking about this program, you're thinking about high impact, short-term projects. So like I said, something where between that 6 to 8 weeks, maybe a little bit less or a little bit more, where a team comes into your community, comes to your agency and your organization, and help support them through that time for something that you would like to see kind of accomplished while that group of individuals are there. Next slide, please. So this is how we're divided in our different offices. Our headquarters are located in Washington, D.C., but then we have 4 different campuses. And as Shannon mentioned, your region kind of overlaps with 3 of our different regions that we have. And if you haven't put where you're from or what state you represent, I would love to see that in the chat, just to kind of see the array of different individuals. I did notice that we had folks from Alabama, Tennessee, Mississippi, and those, and including, so Louisiana, Mississippi, Alabama, Tennessee, once again, are the states that I specifically work with. And so each region has 3 to 4 assistant program directors that kind of cover that region and help develop projects. And those 4 states that I mentioned, I specifically work with those. So I'm very excited to be on the call because that covers about half of your region. And then Mackenzie can talk a little bit more about Southwest region. And then we have one individual, Alana is actually her name, who covers the North Central region. And we'd be happy, Shannon, we can forward everyone's contact information because I believe we'll be working with maybe 4 or 5 different assistant program directors. Kentucky is in our region, but there's another assistant program director that covers that. So we'll be happy to get that different contact information for each individual so that you could follow up with specific information and talk to that person individually.
That'd be great.
So,
thank you.
And so we'll continue. Next slide, please. So our areas of focus include natural or other disasters. And a lot of time when people, if they heard of NCCC, a lot of times they may think about seeing us in times of after maybe a hurricane has come into a community or a tornado, and you may see our teams at that time. But we also have 4 other focus areas: urban and rural development. And I will say probably more of your rural health centers, hospitals would probably fall within that focus area, within that urban and rural development, maybe infrastructure improvement, depending on the needs, like if there's different building needs and things of that nature. If you're thinking about environmental stewardship, then you maybe think a lot of times our projects, trail building, things of that nature, and then energy conservation. And so energy conservation, things like weatherizations of homes, maybe putting in different light bulbs, energy efficient light bulbs, things of that nature. But like I said, the urban and rural development focus area probably would be the area that many of you would fall under. Also, that includes kind of home bills, working with youth, and different community outreach types of programs that may happen in those rural or urban areas. So let's, if we can go to the next slide, please. So to give you some examples of the work and things that can be done with a team of folks coming into your community to do different things. So just to give you a few examples, and it's a wide array. And I often say you may not necessarily see something, but shoot an idea. And if you think that you could use a large amount of people to come in and get it done, we can maybe figure out something and figure out how we can make that work. It depends on the needs of what you have. So even if you don't see it out there and you can say, oh, I've got this need, feel free to reach out to us. But in terms of public facility rehabilitation, you may be thinking about your different public buildings. You could be thinking about your hospitals or your centers, and maybe you need painting, or maybe there's repairs that need to be done. I know that we've worked with, and I think there's actually representative from the city. We worked with the city of Rolling Fork before, and the city actually partnered with several different organizations, one of them being the hospital in that city. And so we were able to do some of the things like some repairs that maybe were needed in terms of painting or whatever it may be. Also, maybe you want to do some other things, like maybe you want to put a mural in a certain part of the wing or do something like that. We have very creative members that can come in and help support that, or maybe do some things like flooring, whatever the rehabilitation needs. As long as there's some guidance there's a possibility that maybe our teams can help support that. In terms of event and volunteer coordination, maybe health fairs, different things that you may have going on in your community, our members can help support that in ways of the coordination beforehand, but then also maybe the hands that may be needed once the event happens. And so they can be a part of that coordination of making things kind of come together and bringing folks together, but then also a big part of the day itself. In terms of neighborhood beautification, maybe that includes just the beautification of the area surrounding the different hospitals. So in terms of maybe different, maybe improving some of the aesthetics of the outdoor space, planting flowers, things of that nature, or maybe it includes working with different partners and doing something like a community garden as a healthy initiative within that community. So a lot of things of that nature could vary, and we have done several of different community gardens. We've also worked on gardens that were specifically for seniors so that they would have a way to go out and have be outdoors and do different things. So lots of different things that our teams can help support. In terms of donation centers, our members have seen a lot, especially during times of disaster, but then also working with food banks, things of that nature. With COVID right now, there may be an uptake in donation centers needing support and within the communities that you serve. And if there are some of your partners, or if you're a part of helping to support some of that, there's different things that members can do. Also with working within call centers and coordination. So if there's any a call center that was receiving high volumes of calls and needs support with a group of individuals, whether it be around COVID or other needs within that community, then the teams can help support that as well. That also includes, you may be trying to find out more about your population that you serve. And maybe you're interested in implementing some new programs and you want to think about different assessments. You want to do other things such as community outreach to bring folks into different programs that you're providing. Our members can do that as well. So it's not necessarily the direct, always hands-on, but then also they can offer that other support, indirect support as well. Other activities may include things like playground improvements. And then, like I said, the disaster long-term recovery. We've had teams that have supported Hurricane Katrina Wade long into the effects. So not just being there shortly after the disaster, but helping to build homes. After that, I could see us also assisting with other long-term recovery efforts in communities that are impacted by COVID. Also, we support contact tracing, and I'm going to let Mackenzie kind of talk a little bit about more of that because I know that they've done a lot of that with their teams out of her region. But then also we have teams currently serving as logistical support. And I know specifically we have teams that are in Delaware and New York and that part of the United States helping to support those vaccination areas. So a lot of times if there's special initiatives or if there's a major disaster, we'll actually see teams even out of our region to help support those high needs that may be in a certain community. Mackenzie, did you want to add anything else about the COVID contact tracing and different projects that you've had out of your region?
Yeah, thanks, Tamika. I think you covered the high-level aspects of that work. It is a kind of new and emerging project need. So if you all have any interest in exploring ways that AmeriCorps NCCC might be able to supplement contact tracing that's happening either at a city level or regional level or at a state level as well, that's certainly something that we're open to talking about and that we've had team support in the past, and has been, really a quick way to meet those really pressing community needs in terms of making calls to folks after they've tested positive, talking through what isolation looks like, what quarantine looks like, and then, doing that really important contact tracing work to map out potential exposures. One thing to note about contact tracing is that the structure of our program, as Tamika mentioned, is designed to be short term. So it's not ever intended to replace paid staff, really just to supplement in those kind of peak times where you just need some additional staffing resources to be able to help make all those calls and notifications and do that really time-sensitive work of mapping out potential exposures. And then more recently, in the past, I would say even only 2 or 3 weeks in the Southwest region, we have been reassigning some of our AmeriCorps NCCC teams to serve and provide logistical support at COVID vaccination sites. And so that can be anything from, managing crowds to providing observation after the vaccines have been administered, making calls, doing kind of community-based education around the vaccine. Those are kind of some high-level overviews of those particular types of COVID response projects that AmeriCorps NCCC has been able to support in the past few weeks and months. Thank you.
Thanks, Mackenzie. Next slide, please. Well, we also realize that COVID-19 can have great impact on communities and several different agencies. And so in terms of being able to support that, if maybe you're having a loss, you notice that some of your partner agencies that you all work with, or you have lost, certain volunteers, or is putting a strain on staff, or, there's different things that we can help support with a team of folks coming in. So we do realize that this will probably, like I said, be a long-term impact type of needs that will be out there in different communities and for different agencies. And so we want to make sure that we're helping to support that, along with maybe some of the immediate needs with COVID-19, but then also if there are any of these that your organization is facing, or of other organizations that are facing this, please reach out to us as well, and we would love to help support that as well. Next, I'd like to actually turn it back over to you, Mackenzie, and Mackenzie's going to tell you a little bit more about what we ask our sponsors to do and what it looks like, the application process looks like, and all of that.
Great. Thanks so much, Tamika. So we've mentioned sponsor a few times. I just wanted to check in and be sure that we were all familiar with that language and what that means. So our sponsors are organizations who are interested in working with and engaging and hosting an AmeriCorps NCCC team. And they will, work with one of us assistant program directors to kind of vet the idea, make sure it's appropriate, given the program design and scope, and then work through the application process. And we'll talk more about what the application process looks like, but first just wanted to touch on eligibility. So who is eligible to apply to host an AmeriCorps NCCC team or sponsor a team? So on the screen you'll see is a list of organizations who are eligible. That includes nonprofit organizations, both secular and faith-based, local municipalities or city governments, state government agencies, federal government agencies, Native American and Alaskan tribes, as well as national or state parks, forests, and other public lands, and schools. So really here we're it's probably easier to think about, who is not eligible to be a sponsor, and really those are the for-profit organizations. I know with COVID vaccinations, sometimes there's some for-profit partnerships going on. So just if you are interested and you kind of fall into that camp, don't rule this out just, because you don't see pharmacies or some of the other for-profit organizations listed on the slide. Know that doesn't necessarily rule you out, and Tamika and I or our colleagues would be happy to kind of talk to you more specifically about whether or not you're eligible to apply to host a team. But these are a list of our eligible sponsors and the types of sponsors that we traditionally work with. Next slide. So what do sponsors provide? So our sponsors provide a meaningful experience for the AmeriCorps members during their project period. We mentioned the length of time that teams serve with sponsors is variable and dependent on a lot of different things, including, the sponsor need, and also what's happening regionally or nationally in terms of the number of available teams. But it can span anywhere from 3 weeks at the shorter end all the way to 13 weeks at the longer end per project period. And sponsors will submit an application for each project period that they'd like to be considered, up to a total of 60 weeks, 60. So our sponsors are responsible for providing that on-site technical oversight or supervision for the team when they are placed on site and working with a sponsor. They are asked to provide a detailed work schedule and training and an onboarding plan that includes a minimum of 40 hours of enriching service per week per member. They're asked to provide all of the necessary project supplies, equipment, and materials, as well as any building permits that may be needed. They're also asked to provide AmeriCorps NCCC members with lodging, with showers and a separate quarantine space in the event that members are, experiencing COVID symptoms or have tested positive. And again, Tamika and I or the other assistant program directors would be happy to work with you on kind of the specifics of lodging. And a lot of times we find that our sponsors have really strong community partnerships with churches or community centers or institutions of higher education where they can utilize dorm facilities or local camps, and they're able to stay in cabins. So again, don't let this be a barrier. It's certainly something that we're happy to work with you on and do some brainstorming and troubleshooting. But that is a kind of a big piece of what our sponsors provide, and we just want to make sure everyone is aware of that. In addition to lodging, we ask the sponsors to provide cooking facilities so that the team can provide all of their meals, unless sponsors are providing all the meals for the team, as well as an inclement weather plan in the event that project work is impacted by weather. So specifically, if sponsors are wanting to engage the team in an outdoor type of service, so that if inclement weather arises, we've got a kind of a plan for how we're going to work with the team. Next slide, please. So AmeriCorps NCCC provides the following to sponsors who are awarded AmeriCorps NCCC teams after they, work through that application process. So we provide background checks, TB tests, and a 10-panel drug screening for each member, in addition to pre-deployment COVID testing and then ongoing daily screening. Each team is coordinated and managed by a team leader who handles any of the team concerns and sort of serves as that liaison between the sponsor and the team and the AmeriCorps NCCC professional staff who are working at the regional campus. Each team is provided with a 15-passenger van to transport them to and from their project sites and lodging facilities, and then the regional campus in between their project spikes or their different project assignments, as well as gasoline and insurance. And then each member is covered with workers' compensation. They're provided with health benefits and Federal Tort Claims Act coverage as well for any damage that may occur while they're acting within the scope of their official duties. And then lastly, all of the AmeriCorps NCCC teams are provided with a budget to cover all food and laundry expenses, as well as any tolls. Next slide, please. So in this slide, you can see kind of what the application process would look like. So the first step would be to get in touch with your regional campus. And again, you'll have contact information for Tamika and I. You'll also have access to the slide deck, and you can refer back to that map that kind of outlines the different campuses, and you'll see what campus your state falls within, and then within that regional campus, we kind of divvy up certain states between all the assistant program directors. So once you identify your point of contact, that will be the individual that works with you and provides support to you throughout the full duration of the application process. I'm happy to brainstorm lodging with you, talk about the scope of the project, all of that good stuff, as well as make sure that you have an understanding of the application process and deadlines and access to all the forms and all of that. So once you've been in touch with your regional campus, the next step will be to complete a concept form. And this is an abbreviated version of the full application, where really you're just outlining the concept of the project. You're including information on, perhaps some housing ideas that you have and all of your points of contact. And that's really just used as a vetting tool, so that you don't spend, a ton of time completing this application and then come to find out, you're not eligible for whatever reason, or that type of project isn't maybe necessarily best served by AmeriCorps NCCC, in which case we'd be happy to connect you with the other AmeriCorps programs. So that's that first step, the concept form. And then after that, you'll be invited to submit a full application, which will include that work plan that we talked about that details kind of what the team members will be engaging with each day they're working with you all, as well as an orientation and training plan that helps the team to understand what their first few days are going to look like in the community, and how they're going to be learning about you and what you all do and your staff and all of that. Next slide, please. So on this slide, you can see for the two of the four campuses, the Southern region and the Southwest region, the states that are served by our regional campuses, as well as our upcoming project dates, and then the deadlines for the concept form and then the full application. And then underneath that, you can see our telephone number and then our regional email address. So you can just always reach out to the regional email address and then figure out who the appropriate contact will be for you. Next slide, please. And then here you can see just a couple of quotes from sponsors. During the time they were here, AmeriCorps NCCC team members became part of our town and our organization. They brought youth, commitment, and hope with them, not just hammers and hard hats. They served as examples to our locals who responded by becoming more involved in the concerns and the problems within the community. From a sponsor at Hope Havens Children's Shelter in Mississippi. And then another quote, the NCCC team helped us to be more prepared for our annual workday and to provide better quality services for our clients. The team members came to us full of energy and ideas. They brightened our lives and the lives of our clients. And then some encouragement and words of advice for future sponsors. Think of all the things that you wish that you could do but can't. And then think about how an NCCC team might be able to help you do them. Thank you. Next slide. And that brings us to the conclusion of our presentation. This is the contact information for Tamika and myself. And at this time, we'd love to answer any questions that you may have about the AmeriCorps NCCC program.
Thanks, Mackenzie and Tamika. So yeah, just like before, you could unmute yourself if you have a question or type it in the chat. And we're lucky enough to have all three of our speakers still with us. So if you have a question for Christina that has come to mind since in the last half hour, please feel free to ask Christina that question as well. While we wait for any typing to happen, I'll just thank you, all three of you, Christina, Tamika, and Mackenzie. It's great to hear about these programs. Such great resources for the right project and the right situation. So thanks to all of you watching the webinar. Feel free to contact Christina or Tamika or Mackenzie directly for more information. You can also, as always, contact me anytime or any other member of the Delta team to help you think through how either of these programs might fit the needs of your organization. And we can also put you in contact with the right person. So thank you, everybody. I don't see any questions coming through.
Shannon,
Go ahead, Sally.
Yeah, I have a question. Maybe I missed it when I was note taking. So thank you, Tamika and Mackenzie. It's great to learn more of the details of AmeriCorps and the sponsorship. If the sites don't have a need for a whole team, is there a limit of or a minimum number of positions the sponsoring site, if that be a clinic or hospital, provide?
Yeah, so I can share from the Southwest region. I know there might be some campus differences, so Tamika, I'll let you weigh in as well. So the preferred team size for our region is anywhere from like 9 to 12. We have lowered that number a little bit with COVID, and especially with our new housing guidelines and just wanting to maintain physical distance and all of that, to like 7 or 8 now. So there is some flexibility there, but the teams are, once the members apply and they're approved, they're arranged into teams, and then their teams kind of travel together to the different project assignments. And typically that's the kind of standard size for our region.
I would say similar kind of standard size, but I can say that, sometimes we do end up with smaller teams, just kind of naturally. So within your application, you can also say, ideally, I would love to have a team of this size. And if we have a smaller team, maybe we can think about our units department who assigns the teams. They can think about, okay, we have a team that's a better fit. A smaller team would be a better fit for this project. Also, one thing that you can do is kind of say, when you're project planning, think about, well, I can use so many doing this small project and so many doing this small project over here, so that you can split the team up, even if you have a large, since you have a larger number of folks at one time. Or partner with other folks within your community and then have them go perhaps serve with another agency that's working towards your same goal or has similar, things that you all are working towards. But then you could have them work with that agency and work with you if you need to do that as well. And kind of, those are some of the options that you have around that. Sometimes we also do something called composite teams, but those are very limited. And that if they're working on something very specific that needs specific types of skills, sometimes that's when we will send a smaller team and kind of pull that, but those are rare. But I would say trying to think about ways that maybe you can partner or split up the task is probably a better option.
We have 1 more minute for any last minute questions. Does anybody have one?
I have a quick question. Wanted to ask about very short-term projects. How would you pull a team on let's say a 2-week project? And I know that might not be possible, but just kind of thinking of a program that we have in particular that we work with the military on medical missions, and their 2-week projects, and just some of the opportunities that these folks could have by coming in and participating in some sort of way. It will be a really good experience. What are your thoughts on very short-term projects?
I would say 2 weeks is kind of where we would like to, at least for our campus. We have done some 2-week projects, especially when there's kind of that really need that, you come in, this is very short term, but there's a great need and we could really use a great amount of people at that period of time. So we have looked at 2-week projects. They're not, preferably we do have something between 3 to 4, but 2-week projects we do. Mackenzie, have you all, are y'all open to 2 weeks as well?
Yeah, our preferred for a split round project or like a shorter project would be like a 6-week, just because that's half. And so we can serve 2 sponsors in the same round, but we have done it in the past. So again, I would say, don't let that rule you out or, make you decide not to submit an application if it's a real, community need that you want to be addressed, that you think NCCC would be a good fit for. The other thing is our team leaders all, come to campus a month before all the core members, and they go through really intense training, leadership training, safety training, all of that. And we're always looking for like shorter 1 or 2 week projects where they can go out and kind of get the experience of being in the field. And so, that is also an option.
Thank you both.
Just one more quickie. I know we're butting up against the hour here, but there has been a question coming in about your credentials and educational background, just interest in public health careers. And you could tell us that now, or you could send it to me and I could share it out to the group, whatever makes the most sense for you.
Well, I can actually say I was an English major. I was an English major at the University of Mississippi. But it's served me quite well in terms of working with different nonprofits and working. I also did a lot of work with youth, and I kind of continue to do that and working with young adults right now. But I'm assuming that's probably not the normal pathway. Mackenzie.
Yeah, no, I love that, Tamika. Yeah, I got a master's in public administration, and then my bachelor's is in psychology. But I would say, honestly, though, thinking more holistically about the assistant program director team, it's varied. Experiences are varied. Our pathways into this line of work are varied. Some are more focused on community engagement. Some are more focused on, government, like program administration. So it's pretty diverse. But I'm happy to chat offline with anyone who wants to know more about like this role, this program, or professionally how we got here.
That's great. Thank you. So lots of different routes, it sounds like. Okay, well, I know we've gone a little bit over, but so I just want to thank everybody for joining, and just a reminder that this session has been recorded, and the recording and the slides will be posted on our website. And as soon as that happens, you'll get an email notification. So thanks everybody for joining us. We're really glad you were here. Thank you so much to all of our speakers, and I wish everybody a wonderful day.